Immediately after surgery, if somebody looks with a magnifying glass, they will detect the little follicles that have been implanted. However, one of the distinguishing features of hair restoration black rock is that our hair transplants are completely undetectable. They're visible, but nobody notices them. When patients come back to me for their post-operative appointments, they frequently tell me that their friends tell them they've lost weight, they're looking younger, or looking healthier, but nobody notices the hair. One of the distinguishing features of hair restoration black rock is the emphasis that we place on the design of the hairline. We actually have a design team who meet the patient. We use a laser to get the landmarks properly aligned on the skull, and then the whole team contribute to the actual design process. This can take sometimes even up to an hour. The patient is then shown the design that we've done and they give their approval. But I just want to emphasize that the hairline design is one of the most critical features of the actual transplant process itself. A transplant must look natural. That is the absolute key issue. The density or the coverage really is related to the degree of baldness you have or the amount of donor hair you have to supply. But as long as the hair looks natural, nobody will ever detect it. If I see a young man with male pattern hair loss and it's of concern to him and he would like to have a hair transplant, we actually design the hair transplant assuming that he's going to go completely bald. I use the cliche, we hope for the best, but we always plan for the worst. So the worst thing that can happen to that young man is he's going to go bald. We make that assumption when we do the design work, and the hair transplant will sit on its own. It's not the patient is not dependent to come back and have another hair transplant. It must sit on its own. And I use that term, when the tide goes out, what's left behind must look as if nature left it there. In the old days when men lost their hair, they did a comb over. Nowadays, the modern man cuts his hair shorter and shorter because dyeing hair gets very wispy, and when the hair is cut shorter, they look much more neat and tidy. The donor scar is a major issue for a lot of men, particularly with short haircuts. Being a qualified surgeon, I like to believe that I know how to close the scalp properly. The scar that's left in the donor area is approximately 1 millimeter, and if you have a blade 3 or a blade 4 cut, that is more than adequate to cover the little scar that's left in the skin.